So anaesthetic options for the operation. It's a really quite straightforward operation. It's really short. I'd really much prefer to have some form of local anaesthetic rather than general anaesthetic. And you know, I have done a general anaesthetic maybe once in the last couple of years, because I really try and talk patients out of it, because the vast majority of patients, however anxious you are, however nervous you are, even with head tremors, can manage to have the surgery just under local anaesthetic. And I'm going to talk about a different sort of local anaesthetic in a moment. General anaesthetic is available for you. If you've got medical problems, it doesn't make sense risking your life and your health for the sake of cataract surgery when it can be done just under a local anaesthetic procedure. I often get asked about sedation. We don't want to heavily sedate you, because if you wake up halfway through disorientated, it can cause problems, and we certainly don't tend to prescribe it, but there are some places in the country where they will offer you sedation, so it's worth asking. Even if you ask your GP if they can give you something to help calm your nerves before you come, that's perfectly reasonable. Hopefully we can comfort you, and we can give you the reassurance by looking after you in theatre and a good interaction with your surgeon to make sure that you feel safe and cared for, and in that circumstance you will feel better about things and you will feel more sort of relaxed. You're bound to be nervous, but it's important to relax. So if you can avoid a general anaesthetic, it seems to work better. So if you do have a general, that's fine, you're fast asleep, you don't know anything about it. There is a recovery time. You know, with every general anaesthetic, you're a bit groggy afterwards, you can feel a bit sick. The recovery physically may be a little bit longer, but nobody's going to drag you kicking and screaming into theatre, so a general anaesthetic is always an option you can discuss with your surgeon. Local anaesthetic is my preference. You're wide awake, we chat throughout the whole thing, and that chat is important to put you at ease as well. What different forms of local are there? Well, there are two main forms in use at the moment. One is just drops. So we put drops on the eye, numbs it up for you. We start operating. You've got to look up into a bright light for us, and the light is pretty bright. You can move your eye around, so it's important you do stare into the light, and it can be a little bit uncomfortable, a bit of a pressure sensation, a bit of an achy sensation, but the vast majority of patients cope with that very, very well indeed. The other option is to pass a little tube around the side of the eye. It's not a needle, everyone's very needle phobic, but it's not a needle going into the eye, but it's a little tube, but still a little bit unpleasant. And we introduce anaesthetic around the back of the eye, and that numbs it up for you. It is a pressure sensation, and sometimes patients don't like it. We've got to balance up the bit of unpleasantness at the start, and then after that you don't feel anything at all, you can't move the eye, you don't see anything, with the topical, which is slightly different in that you get potentially a little bit of discomfort throughout the whole thing, and you've got to look up into the light. I don't know what the right answer is, and personally I tend to assess my patients on an individual basis and see who's going to tolerate it better. Strangely enough, the patients who don't tolerate the local anaesthetic, the injection, are the ones who probably need it. My priority is safety, and I want to be as safe as possible. And when I do whole lists of topical anaesthetics that are just drops, sometimes I get to the end of the list and think, oh, well, I'm really pleased to have got through that. 2 or 3 of them were really challenging. I'm not sure with eye surgery we should be being challenged, and we should be at the edge of our comfort zone, and I want to be very comfortable when I'm operating, because that's when I'm safest. So I judge patients on an individual basis, and if you've got a high risk cataract, then where it could go wrong or some movement could cause me extra problems, it makes no sense that I make my life harder when I'm trying to care for your eye, so I tend to put a local anaesthetic in. I think it's safer. The anaesthetic's pretty safe. You can get a bit of a red eye afterwards, but it numbs it up. It's definitely more unpleasant than the topical initially, but some patients, some patients prefer it. And I've actually done 30 cases whereby both eyes were done, and I did topical drops for 15 of them, and then swapped to a subtenon injection for the second one, and then the other way around. And the split was about 50-50, and people preferring one over the other, so one size doesn't fit all. But a lot of the surgeons will either use the topical drops or give you a block, and I think either way is perfectly fine, but it's entirely reasonable to discuss it with your surgeon. I'm not sure what I'd have done, and often I get asked that. I think I'll probably have a block, because then I can just forget about the whole thing. I know I can't move the eye, it numbs it up. When I have my teeth done, they inject me and it numbs it up, and it's a little bit unpleasant with the injection, but then after that I can just forget about it. So I think I'll probably have a block when I have my cataracts done, but it is individual preference. Discuss it with your surgeon and they'll help you.